Cancer thrives when you skip these 4 powerful anti-cancer spices. Cancer thrives when you leave out these 4 powerful anti-cancer spices. Today I'm walking you through 4 everyday spices worth including if you want to support your body after a diagnosis. They may look simple, but the way you use them matters more than most people think. If you're currently in treatment, finishing treatment, recovering, or even years beyond your diagnosis, this video is for you. These small dietary choices can help calm inflammation, shape immune function, and support long-term health, including lowering the risk factors linked with recurrence over time. Let's begin with number 1. Garlic. Garlic is one of the most researched culinary ingredients in the world of cancer biology, yet it is still widely underestimated. Garlic contains organosulfur compounds, and those compounds are released when you chop, crush, or smash it. In laboratory studies, these compounds have been shown to slow cancer cell growth, support immune surveillance, and enhance liver detoxification pathways. What I want you to understand is that garlic doesn't behave like a medication. It isn't about hitting one target and expecting one result. Garlic helps shape the internal terrain, creating conditions where abnormal cells have a harder time thriving. That broader effect is often more meaningful than focusing on a single mechanism. Early in my cancer research training, I learned to respect how complex cancer truly is. It is not one switch you can flip off. Multiple systems interact at the same time, and garlic supports several of those systems together, including inflammation regulation, immune modulation, and hormone metabolism. When I was dealing with stage 3 cancer myself, the deepest struggle I faced was exhaustion. And when someone is depleted, immune resilience can suffer. Garlic can support immune cell activity, including natural killer cells, which help identify and clear abnormal cells. Population research has also linked higher garlic intake with lower rates of certain cancers, especially cancers of the digestive system. These studies cannot prove direct cause and effect, but the consistency of findings across different regions and cultures is hard to ignore. Inside the Cancer Freedom Program, I once worked with a breast cancer survivor who felt buried under supplements, protocols, and complicated routines. We simplified her plan dramatically. One of the steady changes we made was consistent use of biologically active foods, including garlic. Within a few weeks, her energy improved, her digestion settled, and just as importantly, her confidence came back. That matters. Confidence and clarity after cancer are powerful. Garlic may also support estrogen metabolism, which is especially relevant for hormone-sensitive cancers. It can help the liver process estrogen more efficiently, supporting healthier handling of estrogen metabolites. This doesn't mean you need to eat raw garlic cloves every day. The goal is regular, intentional inclusion. Chop or crush your garlic, then let it sit for about 10 minutes before cooking or adding it to food. Do this most days of the week, and you build that cumulative benefit over time. 2. Turmeric. Turmeric gets mentioned everywhere, but most people never hear the full explanation. The key compound in turmeric is curcumin, and it has been widely researched for both anti-inflammatory and anti-cancer effects. Studies show curcumin can disrupt cancer-related cell signaling, help reduce angiogenesis, and encourage apoptosis, the body's built-in process of programmed cell death. This matters because chronic low-grade inflammation is a well-known driver of cancer progression and recurrence risk. When inflammation stays elevated for too long, it creates a biological environment where cancer cells are more likely to grow, divide, and even slip past parts of the innate immune system. Turmeric influences multiple inflammatory pathways that are deeply involved in cancer biology, which is one reason it continues to stand out. Before my own diagnosis, I approached inflammation mostly as a research topic, something I studied from an academic distance. After diagnosis, I felt inflammation in a completely different way. That heavy, relentless fatigue that isn't just emotional, it's physiological and inflammatory. From that point forward, supporting inflammation control became a core pillar of my recovery. Here's a crucial point most people miss: turmeric's bioavailability. Curcumin is poorly absorbed when taken alone. That's why combining turmeric with black pepper matters so much because it can dramatically increase absorption. Fat also improves uptake, which is why turmeric tends to work best when you consume it with food as part of a meal. Large laboratory studies suggest turmeric can slow or inhibit the growth of multiple cancer types, including breast colorectal prostate and even pancreatic cancer. Human trials point to improvements in inflammation markers, and curcumin has also been associated with better pain management and improved quality of life in cancer survivors and those living beyond treatment. In my clinical work with cancer thrivers, turmeric is often one of the first anti-inflammatory tools we bring in. Ideally, we start with food, and in some cases we use supplements, but food comes first whenever possible. Used consistently, turmeric sends a steady anti-inflammatory signal through the body. I worked with a breast cancer survivor in the Cancer Freedom Program who struggled with persistent joint pain after treatment. Instead of immediately relying on high-dose supplements taken multiple times per day, we used a focused nutrition strategy. Turmeric became part of her daily routine. Within about a month, her pain scores dropped significantly, and she felt more connected to her body again. That feeling of control matters after cancer. When the body has been through so much, small, consistent actions can become a powerful part of healing. 3. Ginger. Ginger is at the top of my list because it connects two worlds at once: symptom relief and cancer biology. Ginger contains active compounds that have shown anti-inflammatory, antioxidant, and anti-proliferative effects. Most people know ginger for helping nausea, especially during chemotherapy, but its value goes well beyond managing that single symptom. Studies suggest ginger may inhibit cancer cell activity and reduce oxidative stress. Oxidative stress is harmful because it can damage cellular DNA, and over time, that kind of cellular damage can contribute to cancer development or progression. Ginger helps neutralize free radicals and supports the body's own antioxidant defense systems. During my own treatment, exhaustion was constant, but my digestion was also thrown off. Ginger was one of the few things that reliably calmed my system. That matters because when digestion improves, nutrient absorption improves too. And nutrient status directly influences immune function and the ability to recover and rebuild. Research also indicates ginger may reduce insulin resistance and support metabolic health. That's important because higher insulin and blood sugar levels have been linked with poorer cancer outcomes. In simple terms, ginger helps steady the internal environment. It reduces physiological instability, and cancer thrives when the body is in chaos. In my clinical practice, I've seen ginger support cancer survivors and those living beyond treatment who deal with nausea and vomiting, but also bloating, appetite loss, and broader inflammation. One breast cancer survivor I worked with struggled to get enough protein for recovery because her nausea and low appetite made eating feel impossible. We introduced ginger tea before meals, and it helped her tolerate food again. That shift improved her strength and supported her healing. It's the kind of benefit that might not show up dramatically on a scan, but it can absolutely transform daily quality of life. And over time, you feel a real difference. 4. Cayenne pepper. Cayenne contains capsaicin, the compound that creates the burning heat. In laboratory research, capsaicin has been linked with cancer cell death. It has been shown to slow tumor growth and interfere with cancer cell metabolism, making it harder for abnormal cells to sustain themselves. What makes cayenne especially noteworthy is how it influences circulation and metabolic function. Capsaicin can increase blood flow, which may support better delivery of oxygen and nutrients throughout the body. That improved circulation can help promote conditions that are less favorable for cancer cells. There is also evidence that capsaicin can disrupt certain signaling pathways that cancer cells depend on for growth and spread. Most of these findings come from lab-based studies, but the biology behind them is plausible and consistent with what we understand about cancer behavior. At the same time, one point needs to be emphasized clearly. Tolerance matters. Cayenne is not a good fit for everyone, and it should not be used in large amounts. Some people have very sensitive digestion, and that sensitivity can be even stronger after cancer treatment. It is never worth forcing it if it causes discomfort. Instead, small and steady is the better approach. A tiny pinch added to a meal a few times a week can be enough for regular inclusion. Capsaicin has also been studied for its relationship with obesity and metabolic health. Excess body fat and higher body weight are strongly associated with increased cancer risk, and this connection is especially relevant for breast cancer survivors and thrivers. As someone who has both lived through cancer and studied it, I'm always looking for strategies that support the whole body, not just one single target. Cayenne can contribute by influencing inflammation, metabolism, and cellular signaling. And these 4 spices matter, but they are not magic. Their impact is cumulative, built through consistency over time. Every meal sends a signal to your body. Over time, those signals help shape your internal environment, shifting it away from the conditions that allow cancer to thrive. 5. Cinnamon. Now, let's add a 5th spice that supports the same big picture goals: cinnamon. Cinnamon is often treated like a sweet flavor, but from a metabolic and inflammatory standpoint, it deserves much more respect. Cinnamon contains bioactive compounds such as cinnamaldehyde and polyphenols, and these have been studied for anti-inflammatory and antioxidant activity. In laboratory research, cinnamon extracts have been shown to influence cancer-related cellular behavior, including slowing abnormal cell proliferation and increasing signals that encourage damaged cells to shut down rather than keep dividing. What makes cinnamon especially relevant in a cancer recovery-focused lifestyle is its connection to blood sugar control. Your internal metabolic environment matters. Persistently high blood sugar and high insulin levels are associated with worse outcomes in multiple chronic diseases, including cancer. Cinnamon has been studied for improving insulin sensitivity and supporting healthier glucose handling, which helps calm that metabolic stress. In plain language, it helps reduce the internal conditions that keep the body in a more inflamed, unstable state. Cinnamon also supports oxidative balance. Oxidative stress can damage DNA over time, and while the body has its own defense systems, those systems need support when you are healing. Cinnamon's antioxidant profile helps reinforce the body's natural protective mechanisms, especially when used consistently, not occasionally. One important note is quality and dose. Cinnamon is not something you need in huge amounts, and more is not better. Small, regular use is the goal. Sprinkle it into oatmeal, stir it into yogurt, add it to smoothies, or use it in warm drinks as part of a meal. If your digestion is sensitive, start with a light amount and build slowly. Cinnamon is not a cure, and it is not a standalone strategy. But as part of a consistent routine, it supports inflammation control, metabolic stability, and cellular protection. And those are the exact foundations that help shift the body away from the terrain where cancer tends to do well. 6. Rosemary. Rosemary is one of the most underrated spices in the anti-inflammatory conversation. It contains powerful plant compounds like rosmarinic acid and carnosic acid, which have been studied for antioxidant activity and immune-related modulation. In laboratory studies, rosemary extracts have shown the ability to influence pathways involved in abnormal cell growth, including mechanisms tied to oxidative stress inflammation, signaling, and cellular self-regulation. What makes rosemary stand out is that it supports the body's defense systems in a broad way. Cancer is not a single pathway problem. It is a systems problem. Inflammation, oxidative damage, immune surveillance, and metabolic strain all interact. Rosemary's compounds have been researched for helping reduce inflammatory signaling while also protecting cells from excessive oxidative stress. That combination matters because long-term inflammation and ongoing oxidative injury can create a more permissive environment for disease progression. Rosemary is also interesting for how it fits into everyday food. This is not an exotic supplement. It's a culinary herb you can use consistently without creating a complicated protocol. That consistency is where the real power is. A small amount repeated over time is more meaningful than a large amount used once in a while. In practice, rosemary works best when it becomes part of your normal cooking rhythm. Add it to roasted vegetables, soups, eggs, chicken, fish, or beans. Use it in marinades with olive oil because fat can help carry plant compounds and make them more usable in the body. If you are sensitive to strong herbs, start light because rosemary is potent and you do not need much. Just like the other spices, rosemary is not magic. It is a signal, a steady message that supports inflammation balance, cellular protection, and immune resilience. Over time, those small signals add up, and they help guide the body toward a more stable internal environment. As you can see, these spices aren't magic bullets, but they are powerful, consistent signals you can send to your body every single day. Garlic, turmeric with black pepper, ginger, cayenne, cinnamon, and rosemary all support the same foundations: lower inflammation, stronger antioxidant defenses, healthier metabolism, and a more stable internal environment where cancer has a harder time thriving. Small choices repeated over time can create real momentum for healing. If this video helped you, please subscribe to the channel and turn on notifications so you don't miss the next episode. And share this with someone who needs a simple, practical way to support their recovery.